Well, hello and welcome to the Workforce Development Learning Community Session 6. Please note that all lines are currently muted. This session is being recorded, and you may submit questions and comments into the chat throughout the session. Please also introduce yourself in the chat by entering your name, state, and organization. There will be ASL interpreters joining us today. To adjust your view, select the view icon in the top right corner of your screen. If you're speaking, please be mindful of any acronyms used to help with accurate interpretation. And I will now hand the session over to Wendy Morris.
Thank you, and good afternoon, everyone. We are so delighted that you are choosing to be with us here today for our Workforce Learning Collaborative. Just a reminder, the purpose is to really showcase some state successes and some great work that's happening nationally. We really want to brag on that great work so you can borrow those strategies, those innovations, and that together we can build synergy to really move this forward. We also are informing other work such as NASMHPD's Behavioral Health Workforce Resource Guide, which we update each year, and other work that we're doing, and again, synergy for work happening around the nation. This is the 6th in a series of this year's TTI projects that you can watch. All 2024 sessions, as well as the 5 sessions from 2023 are available to view, and we can put a link for that in the chat. So if you aren't able to join us live, you can always watch it later. We are really, really excited today to have NASMHPD's own Raul Almazar with us. He's going to talk about the concept of organizational wellness and how it relates to workforce issues. He's going to help us understand the impact of historical and organizational trauma on organizational function and the importance of fostering trauma-informed organizations. And then he's going to help us explore some practices that other entities have put into place to strive for organizational wellness. And if you joined us last month for Neely Hicks' presentation on trauma-informed and TAMR, that program, this is almost a part 2. It's a little, so if you were able to watch the last one, you're going to really enjoy this. So we are super excited, and with no further ado, I'm going to turn it over to you, Raul. Thank you so much for being here.
Thank you, Wendy. You guys can hear me okay?
Yes, we can.
Thank you for the invite. Thrilled to be doing this. I think a little bit of background. One of my journey, especially with NASMHPD, goes back to the restraint and seclusion reduction days. And we were the project coordinator for the National Center for Trauma-Informed Care. And we were going around the country helping people reduce the use of seclusion and restraints. And in that work, one of the requirements that I do as part of that work is that I will sit with direct care staff and have conversations about the organization that they're working in. And a common occurrence would be that someone would tell a story of something bad that happened in the organization. It would be a bad suicide, there's no good suicide, but really a horrendous event. It could be restraint seclusion related, but there's usually something that comes out that people talk about. And I would ask people, that say to them, that's a horrible thing that happened. How long ago was that? And I'd get answers like, 5 years ago, 6 years ago. And one of the things I came to realize is that there are certain events that happen in organizations that organizations do not heal from and gets embedded into that organization. And so that's where I began to really look at organizational trauma, organizational wellness, organizational health, healing organizations, taking a look at all of those. And as we talked about recruitment and retention, that the same issue came up around what type of organization are we recruiting to and trying to retain people. And many of that answer goes back to that organization's history that pretty much affect the present functioning. Good example of this for you folks, like how many of you have coworkers or have staff that work that they've been there less than 6 months, but they can tell you all the bad things that have happened in that organization? Very, very common. Why? Because that's the organization's historical narrative. It gets passed on from generation to generation. So one of the strategies I really am going to share with you guys today are ways in which we help organizations take a look at history, but also take a look at healing and practices that can help people really move forward in terms of the way the place functions. So I will let me start my. So let me start with you guys can see my PowerPoint, right? So let me start with a big picture, and I've been working with more organizations around this. So the question is, what type of organization are we recruiting to or trying to retain people? The pandemic, this is really very interesting, because one of the things, and as we know, and part of the reason why we have developed this learning collaborative and all kinds of strategies around workforce, is the pandemic really created a crisis, which is important. And as I go around and work with different organizations, the people talk about the effect of the pandemic on them. I mean, that's pretty clear. But I think the other piece that I try and help organizations to understand is the pandemic did not create many of the things that the organizations went through. The pandemic highlighted and magnified some of the issues, but there is a pre-morbid personality of that organization. And a lot of times people look at the pandemic, blame the pandemic, but in fact, a lot of these issues started before, I mean, and we'll talk a little later about the principles of trauma-informed organizations and how they really relate to a lot of the issues we run into as part of our human resource workforce development issues. But for example, I have an organization where when you talk to the direct care staff, a common sentiment is that when a mental health worker is hurt on the job, nothing much happens. They get workers' comp or whatever, but nothing much happens. But when a clinical staff, especially a physician, gets hurt, the client may get transferred or something happens. That, for those of you who have been around many years, that's a common sentiment in many, especially in a hospital setting. During the pandemic, many of the organizations, the clinical staff were able to either work at home or work from their office and may Zoom onto the unit. And of course, our direct care staff had no choice but to work on the unit. Those sentiments of inequities existed before. The pandemic highlighted a lot of the inequities in the system. And one of the issues that we encourage people to think about is that there are remnants of this post-pandemic. Those feelings, those resentments persist post-pandemic. They have to be attended to. So the really to understand the pandemic definitely was a disruptor for us. And what can we do do that? So understanding the pre-morbid characteristics of the organization. In the culture change world, as you know, we talk a lot about to be able to change culture, you unfreeze the culture, you create the disruption and begin to create new practices, and then you refreeze. And in fact, we can see the pandemic has unfrozen many of the cultures that we work in as really as an opportunity. And that's why we really talk a lot about how do you move forward in terms of once you understand the wellness or lack of wellness of an organization, you are in an unfrozen state. This is a perfect time to be able to introduce or alter some of the practices to get organizations to be healthier so that we can attract more people. And when we're talking about workforce, you know, the whole concept around it's not just recruitment and retention. There's the whole issue of presenteeism and absenteeism. You know, I mean, I know of organizations that may be fully staffed, but have very, very high usage of Family Medical Leave Act. So people are not at work anyway. So it's still a workforce shortage, even if the positions are filled. And again, a lot of the work that we've done with organizations is taking a look at call-in rates, use of FMLA, and helping people understand those are symptoms. Like I would say to folks, that's a symptom. Why is it that the workforce feel okay to call in and leave their coworkers with all of the work? That's a symptom of something that's happening in that organization. So we talk about organizational trauma. One of the issues that we and post-pandemic resilience, one of the issues that I'm in California right now, and this one an issue we were dealing with one of the organizations. Many programs we are trying to recruit into are maybe in smaller communities, you know, whether it's rural, suburban, are in smaller communities. And one of the things that we look at is the amount. I am working with a program that has high rates of staff injury. And those staff that get injured go to the same emergency room in the local community hospital. And so the reputation of the program from that emergency room is that's not a safe place. So if you think about not paying attention to how the organization is perceived in the community, because that may hinder or promote retention and recruitment. Right. So in this program, you know, we there was a significant event that with a lot of injuries. The CEO of the program went to the emergency room to thank the manager of the emergency room for having taken care of the staff, and gave a brief overview of what happened. It really was out of an event that's out of the ordinary. So paying attention to what happens as things, because many of the places we're recruiting into are part of the community. And what is that reputation in the community? I'm sure you guys have already taken a look at generational recruitment and retention, generational hiring. We know what are some of the issues. One of the issues we run into, especially in many in the state system, is the whole issue around unionized environments. It's not necessarily the union, but one of the things we're coming to realize in the work that we're doing is unionized environments are basically based on seniority. So the more senior you are, the better, the better schedule, the better shifts. We know all of that. That's legitimate. That's part of the system. The issue that we're running into in terms of recruitment is that the younger generation are very clear that the type of jobs they want to go into are where they can find meaning and purpose and where they can make a difference. The issue is when that young worker comes into a unionized environment, they not only get the least desirable schedule, they probably get the least desirable assignments. And so how do we build into those jobs, that entry-level jobs, a way for these folks to find meaning and purpose, not just scut work, when we want to think about retention of the younger generations we are recruiting? So that's one of the areas we've been looking at. This is I love this. I mean, I go to many places. I'm sure many of you have heard this, right? We are not competitive. Why would they work here if they can get the same pay down the street at Walmart? Just had this conversation yesterday with someone. I understand that that statement is trying to make a statement about the pay, that they can get paid the same as Walmart. But think about the translation of that statement. Could the person saying that also be saying, this place sucks? So if they can get paid at Walmart, why would they come work here for the same pay? So that's why I think it's so important to take a look at organizational wellness, organizational functioning, because I think that there's something to that statement that pretty much says, I am not able to sell the other advantages of being in my organization so that they can get the same pay down the street, but they will come here to work here because of these are the things that we can offer. So one of the things that I've been doing more with some organizations is just reviewing, and I'm sure many of you have done this, just reviewing what are some of the criteria that many places use for looking at the best companies to work for. US News looks at quality of pay, and this comes out from answers from surveys from workers, quality of pay and benefits, work-life balance, flexibility, job and company stability, physical and psychological comfort, belongingness and esteem, career opportunities and professional development. And you can see it's also ranked. Look at Forbes also puts this out. I picked out two of their comments in terms of their latest survey, that while finances play a role in many Gen Zs and millennials' career decisions, pay is the top reason both generations have left an employer in the past 2 years. It's far from being the only factor. Work-life balance is their top consideration when choosing an employer. And when it comes to job satisfaction, purpose plays a major role. Nearly 9 in 10 Gen Zs and millennials say having a sense of purpose at work is key to their job satisfaction. Talked about that, especially in environments where they come in as junior. This is one of the ones that I love when they talked about this, that the organization's values align with their own practices as well as the person's own values. So one strategy that I will offer you, I've looked at many publications, and I'm sure you have, of what makes people work and stay and happy in a work environment, and it's pretty much the answer is the same. I use a number of AI programs, posted the questions in AI, the answers are pretty much the same. It's all in that realm that US News has identified. So I'll offer you one example. So this is pre-pandemic. This is a state hospital that we've worked with in Appalachia, and a part of the Ohio mental health system. And they brought in trauma-informed care and understood trauma-informed care. So they have worked hard in terms of their culture. And one of the things around trauma-informed care that we help people is, in your journey as part of trauma informed and trauma responsive, eventually you should look at your hiring practices. And it's consistent with this Forbes survey. One of the things that we encourage is values-based hiring. And so this was from 2016. I got this from their manager. That's when they started their values-based hiring. So the committee discussed ways to implement values-based interview questions. The idea was that it is easier to hire staff that think like us rather than hire staff and attempt to make them think like us. That part, I think, is one of the other issues, especially around values. And this is, we've heard this a lot from the retention standpoint. I don't know how many of you have in organizations have a fair number of people start and don't last very long, maybe just a month or two. And one of the things that we hear as part of that is, I got this in orientation. That is the idealized version, or including the values of this organization, and I get to where I'm working, and basically the message is, that's not how we do things here. I mean, that disconnect is actually a reflection of the values. So what they did is they identified their core values that they want to look at. And then, and part of this is not just executive staff. They went out into their programs to ask staff, what do you think are some of the core values that we really share amongst each other? And then what they did is that they took those values and they created questions under each of those values that a manager can pick from, depending on the do I not have a, I don't know if you can see this. I mean, this is, for example, under compassion, tell me about a time when you were sensitive or compassionate to a patient in an emotional or tense situation. An example when your compassionate attitude caused a patient to stay positive and calm. Under the thing I liked about what they did is that they created these questions so that people had choice depending on where the interview might be going. So based on their data, basically, well, let me go back. From 2015, so from 2014 to 2015, they hired 23 staff. 6 of the staff hired, retained 6 out of those 23 at a 26% retention rate. When they implemented value-based hiring process, 2015 to 2016, they hired 29 staff. 20 of them were retained, a 69% retention rate. So the 43 increase in retention rate, in simple strategy in hiring people whose values match that of the organization. So as we think about organizational practices, I want to talk a little bit. I mean, many of you may be familiar with Sandra Bloom, but I think this is one of the areas that is easy to look at, not necessarily just for your organizations, but also one of the things that we in one program, one of the things that we were looking at is the implementation of the strategy around having interns and students, because we want to be able to convert those to employees. I mean, that's one of our recruitment strategies. It's a good organization, but as many of you know, if I have 15 units, if I have 15 programs, some programs are better than others. And one of the things that the folks who are doing the recruitment and bringing the program in was not realizing was that there is one program that is not the best program, that has high turnover rate and tends to be short staff. And so makes sense. That's where a lot of interns are sent, to help supplement the workforce, but they also are exposed to a program that's not healthy. So they had very low conversion rate, because why would people come work there? Right. So taking a look at when we're looking at, okay, we're bringing in these folks that we want to be able to convert to employees. Where are we sending them? What kind of experience are they getting? Because otherwise, our goal doesn't get met. So one of the things, and that Sandra Bloom really has to emphasize, is that organizations, especially organizations that are traumatized, have very much the same characteristics of an organized, a traumatized individual. So pretty simple. You will see lack of self-care, which is lack of physical self-care, lack of psychological safety. We'll talk a little bit more about that. There's a lack of emotional management in an individual, in an organization. You're going to see it's crisis-driven, hypersensitive to threats, responds with counter-aggression by increasing rules, regular forums to manage emotion cease to function. I love this because I see this a lot in organizations that are going from crisis to crisis. One of the first things that get canceled in many of those organizations are staff meetings, the forums in which people are able to heal and process what is happening in the organization are eliminated. So, you begin to see how that becomes really unhealthy. Part of dissociation are fragmented service deliveries, increased silos, reverting to old ways of doing things, identity confusion, failure to get on the same page. This is one of the other things that we see around retention issues is an organization may be healthier, doing well, they've got great programs, things are moving forward. There are good initiatives, but most of those are on the day shift. The other shifts are not necessarily in a healthy state or functioning very well. Again, the issue that we have is that a lot of the new hires end up getting hired into those evening and night shifts, and that's their experience. So how does that affect our retention? Uh, let me I'm trying to see. Communication networks are failing. Organizational boundaries become overly rigid or overly permeable. A failure to mobilize as a system. There's increased authoritarianism, which is leaders are unable to flex their leadership styles depending on what's happening and the demands. Informal leadership may usurp power. There could be disorder, hypocrisy, poor judgments, um, a failure to consider alternative viewpoints. And one of the important parts in this, as we look at organizational wellness, is that crisis-driven organizations or organizations that are not necessarily healthy, it is very difficult for people working in that organizations to be in the gray because of the increased risk for whatever reason, perceived or real. People want to stay in the black and white. And therefore, what happens in those organizations is the inability to stay in the gray or be in the gray, the need to stay in the black and white kills creativity. And we know, based on a lot of what we hear from the workforce, is that being creative and having a room for creativity is one of the hallmarks of what they're looking for. Impoverishment of relationships, there are communication failures, problems cannot be openly discussed. One of the characteristics of an organization that we call an empathic organization is its ability to tolerate strong emotions, right? There's a lack of transparency, making the same mistakes over and over, learned helplessness, risk avoidance, system of rewards and punishment that do not address issues. We talked about this, absenteeism, poor performance, and all of that. You cannot eliminate gossip. Gossip is the oil that lubricates many of our workplaces, but when it becomes vicious, that is what we watch out for. Failure to evaluate effective treatment, focus on quality assurance versus performance improvement, more attention on what's wrong, failure to address losses, continued reenactment, and you get the hopeless, helpless, demoralized staff, burnt out leadership, loss of vision and true purpose. I think that's one of the really significant issues is when there's loss of vision and purpose. So what are some of the strategies we talk about? So connectedness, social support, shared values, commitment, self-determination, those are the resiliency factors or protective factors that we want to build in. I want to give you a few so I'll talk a little bit about this, the key principles, but I want to give you a few examples of some of the things that I've seen organizations really start to turn things around. Orange County Children's Hospital opened a brand new children's psychiatric unit and had a lot of money, beautiful, beautiful unit. But the nurse manager for that program came from Ohio, where we've been doing a lot of work, and she made sure that her staff, all of the staff, got trained on trauma-informed care. They opened the program with trauma-informed care, practicing the principles. And in the process of major training, she invited other people from the other parts of the hospital, and the chief nursing officer decided to attend. And the chief nursing officer basically said, we need to roll this out across the hospital. This is not psychiatry. We need to take a look at our culture. One of the practices they put in place is that every morning, the chief nursing officer and other leadership people, um, or the assistant chief nursing officer, will make rounds every morning, go to every unit, and simply ask the person in charge of that unit, the charge nurse, do you have everything you need to have a successful shift? Imagine the difference that being asked, do I have everything I need? It could be staffing, it could be anything, but just that personal approach that I care about what is happening to you. So that has really changed, especially in nursing, the culture of that hospital. I think, let me see, I think for safety, in let me talk a little bit about safety as the one of the core principles. So one of the things that I love is that when you look at the principles of trauma-informed approaches, just the way we view the world and what we teach the world, those are the same things that people say make for a happy work environment. That people say, I would like to have to stay or work for this organization. So it's really a very easy template for us when we come in and talk to folks about this. So just for safety, I think going back to Sandra Bloom, but the issue around safety is that it's not just physical safety, it's psychological safety of everyone. We heard that also again from the surveys around physical, psychological, emotional safety. Good example, I am in an organization where I told you something significant happened. You know, they needed to debrief. They debriefed, and leadership debriefed, but leadership could not tolerate the strong emotions that were present. So they hardly debriefed. What they did is they talked about what they're going to change as a result of what happened, all of the physical changes and all of that, without the opportunity for people to be able to talk about what their experience. And that's why I had to come and do that part, because it's hard for people to understand. For people to get back to psychological safety, which is heal from that experience, you have to process the experience. Otherwise, those are the experiences that get built into the foundation of the organization, into the historical narrative, and gets talked about 5 years down the line. So I with another program who is celebrating their 50th anniversary, when they talk about individuals coming in, especially clients coming in who are difficult, their measure is that first individual that gave them a lot of issues, as that became the measure of what they can and cannot handle. 5 years later, they're still talking about that incident. So the psychological safety is really a big piece, and we know the workforce is saying that to us, that I want to feel psychologically safe. So actually, one of the things that I love is that, again, Sandra Bloom in the sanctuary model actually talked about under that safety, there are actually 4 types of safety to pay attention to. One, of course, is physical safety. the sense of being safe, living in a physically safe space, physical, biological safety, good health practices, right? Now, this is one of the things I love about what she talks about. She talks about that staff, employees of organizations also watch the way the organization manage the finances. And they put it under she puts it under physical safety, because pretty much what you're saying is mismanaged finances or poor management threatens the security of my job. So that actually is a physical safety. I know my time is getting close. Psychological safety, sense of mastery over one's life, living in a world that has some predictability, self-efficacy, creativity, again, all of the things that people are saying that they're looking for a place. This is Crestwood. These are two examples. I work with them. They have staff break rooms in all of their programs, but next to the staff break rooms or in the staff break rooms are staff serenity rooms. This is a staff serenity room. This is a combined staff serenity room break room. There's moral safety, sense of meaning and purpose, belief in recovery, integrity, courage, and justice, providing and receiving the most effective treatment and democratic principles. And lastly, social safety, feeling secure, cared for, and trusted, ability to be safe with other people, acceptance of differences and diversity. So one of the things that's really helpful for people to talk about. Dollard and Backer talked about this, that it's not necessarily the issue they talk about is that Rikers talked about, we talk about organizational culture, but organizational culture is not really observable. It's an organizational climate, which are the shared perceptions of policies, practices, and procedures, which are observable and that prove to people that this is an organization that cares. That's really what they're asking us to look at. So I'll leave you with a few other examples. So right now, we are working in the Washington, D.C. jail. You heard Neely Hicks talk last week about our trauma program, which is a trauma program. We're introducing the trauma program into the Washington, D.C. jail. There are clinicians that have been trained on that. We are in the present training the officers, which are the guards, to be the co-leaders. And one of the things that's really happening is, and we cannot keep up. I mean, almost all of them want to be co-leaders of this. But one of the things is that they find the space of learning about this program as also their healing space. We're hearing from them that this is a healing journey for me. And it's really changing the way things are in that. My time is up, right? Okay. Let me just see. One program, very simple change. This is very similar to peer support when we talk about our principles. Ask the CEO, how come you have a very, very low turnover rate? She said, I have one principle I follow for my staff. Family comes first. And the whole group work with each other if people's needs are urgent to be able to attend to their family. I mean, so these are very simple ways in which people have really looked at the culture, the nature of the workplace, and how is it that they're functioning and able to recruit and retain into that culture. So that's it.
Thank you.
I
Oh my
didn't realize
goodness.
I didn't
You
realize
did not disappoint. That was phenomenal. Thank you so much. That was just great. And there are so many things I wish we were in the room together so we could just chat, but I know that other people may have questions. So if you do have questions or comments, please put them in the chat. If you want to come off mute, we could have conversation. I loved the Serenity Room, right? Like you, I ran a hospital for a period of time, but now I work from home and I'm the only person here, but I still try to create a space for myself where those few moments between meetings or tasks that I can breathe. So
Right.
yeah, so important to be able to create a space for your staff, especially in really stressful places, right? Like 988 call centers and hospitals and
I actually had a picture of the call center in Hawaii. I didn't get to it. And it's a very small room, but they have those bouncing balls. They have all kinds of tools. They have a little screen with a yoga mat in the back, but it's not just that they have those tools. There's an understanding that I will cover you if you just had a difficult call. No
yeah,
questions asked.
yeah,
Go. The other thing that they do, which I thought was and a happy place, right? Not just because they're in Hawaii, it's just a happy workplace. But one of the things that they do is if I'm not on a call and you're on a call next to me, because they're next to each other, and I see the insurance of the person that you're talking to because they're managed Medicaid, I will start looking at the data for that person for you to be able to help you with your work. I mean,
yeah.
it's just
That's great. I tell you, and when you were when your presentation first started and you were talking a little bit about that cultural history and how a traumatic event can be like, I had that experience in the hospital I worked too, but we talk so much when we're talking about diversity, equity, inclusion, about cultural history and the importance of cultural humility and cultural sensitivity, and you really helped me connect those dots between that kind of works we're doing and then workforce culture. Now that's a cult, right? Workforce culture is cultural trying to shift to be healthy. But if you don't understand the historical perspective, if you don't come in with humility and sensitivity, especially as a new leader, you're not going to be able to shift, right? We have to, as Dr. Sims would say, you have to listen for that history first. And to
right.
your point, make inquiries, do some interviewing. So we do have a couple questions, or at least one. We have tons of comments. So I hope you get a chance to read them all. People are loving this. We may have to have you back next year. But one question comes from Neely, who presented last month. She says, when new leadership is hired and tasked with leading change, how can these values be talked through with existing employees in trauma-informed ways?
Well, one, if you're looking at the trauma piece in many of our systems that we touch, they begin to include a portion on trauma or wellness in orientation. So your leadership should be going through orientation, just like everybody else. One way that I have seen a fabulous, actually, I didn't do this, my staff development person, one of the things at the end of orientation of everyone, she asks them to write a personal mission statement that relates to the mission of the hospital. Everyone walks away with those core values and mission. And she comes to me, tears in her eyes, and said, Raul, you're not going to believe the power of hearing a dietary worker say, I will serve 3 good meals a day to help people recover.
Nice.
I mean, that's how you instill a lot of this.
That's great. Yeah, another point, a very, very poignant thing you said was when you talked about what experiences are we giving our interns, our residents, our students? What is our onboarding process like for new employees? And what they hear from, right, when what they hear in orientation is complete disconnect. I think there has been a long history of undervaluing how important those things are, right? especially when you said about the, I'm like, yes, that's exactly what we do, right? Is we're like, well, this is where we need people. So this is where we're going to send them. Not thinking about, oh, they're going to have a lousy experience there. They're probably not going to want to work here long term.
Right.
Nor spread the word to other interns that you know where you want to do your placement at this organization because it's phenomenal, right? So we kind of shoot ourselves in the foot with that very short term, thinking.
Right.
All right. Are there other questions? We still have, I think, about 5 minutes. If folks have questions, looks like Neely came off mute. Neely, please.
Yes, Miss Nelly. Hi.
Hey, so this was so incredibly insightful, and I've got a page long of notes. Follow-up question on what you just answered. So say it is a new CEO of an organization. All of the people are already aligned with the values, like they bought into everything that the former leader brought. And then now a new leader comes in with new tasks. And we often see people just fired from their positions because there's a huge culture shift going on. So how can that transition be done more respectfully, honestly, and trauma informed in the process?
Well, that's where you really help people to manage up. How do you manage up to that CEO, right? So one of the first things, especially if you have a group that is cohesive, that has been working well, is for that group to be able to take a look at the values and practices and look at how can we make the CEO look good based on the practices that we have. Because what happens with new leadership is that I have to bring in new stuff because I need to look good. I need to show that I'm progressive and all of that. So how can we help this person look good and wonderful as a result of what we're already doing?
And what's interesting about that question though is who is hiring this CEO that is misaligned with the company's, with the organization's values? You wonder, was there a misstep in the hiring process, or does the board of directors or some other entity have another agenda? So that, but I've seen it happen. I mean, as an employee, it's like, what's going on?
But it's not just that, Wendy. I mean, it's a great question because many of those folks are also political appointees.
Yeah, especially
and that's what really shakes the foundation of a lot of places.
Yeah. New administration at the state level, new administration is always going to come in with, a new agenda. That's how they get elected, right? That's a great question. Yeah, I love what your response there about managing up. It's a skill set, but one that's so important, right, to learn for those reasons. All right. Well, I don't see any more questions. Do you have any final comments, Raul? I think the vote is in about having you back next
Okay.
year,
We'd be happy to. As you see, I run out of time. I mean, this is something, my passion, lots more.
Beautiful. Your passion is beautiful.
I could have done, but definitely, thank you for having me. It's we will send you a tip sheet. So just two things in the tip sheet. What I decided to do in the tip sheets are some assessments that are public that you can use. I think many people are familiar with the professional quality of life assessment that for employees. The trauma-informed organ is a really good organizational assessment. I love the Lane Tech assessment. But the other thing that I like, if the trauma-informed organ is pretty extensive, but one of the things trauma-informed organ has is really trauma-informed crisis management. And it outlines some of the things that I talked about after significant events. What are the essential things that you may want to look at to be able to do that. I mean, I'll give you just one example. I just had this great thing, or horrible thing happen in this program. I was there as the charge nurse who was on duty. What happened? Well, she said, I notified my boss calls, and this is horrible. I told my boss the story, and then my boss asks me, what can I do to support you? And she said, get your ass over here. It's like,
Wow.
I am managing a crisis and you want me to stop and think.
Yeah,
How can I support you so you will feel better? And so that the trauma-informed organ has really get really nice steps around crisis management, because it's how we manage those crises that also gets embedded in the history. They remember that.
absolutely. It's too often that people feel like it's right. There's an investigation and people are being asked a lot of questions and they're being put on administrative leave till we can get to the bottom of it. And we're asking if policies were followed and kind of forgetting that humanity and all of it and what the staff has been through. Again, just phenomenal. So appreciate your
Thank you,
time
guys.
today. Appreciate it. All right. Well, everybody, thank you again for choosing to be with us today. We're so grateful for you to be here. Our next meeting, Ava's going to put the details in the chat. Our next meeting is July the 18th. We're going to be having Dr. Tina Robbins and Beth Kuhn back from Kentucky to talk about building your workforce development and innovation infrastructure. So as you may recall, they've taken if you joined us before, they've taken a very comprehensive approach in Kentucky, and they're going to share their top 10 tips to do that. So we are excited for that program next month on July 18th. So thank you, everybody. Have a fantastic day, and we will see you next month.
Thank you. That does conclude today's session. You may now disconnect.